All right, the proposal is that governments should guarantee health care to all of its citizens.
Hi, I am Mariana Oliveira and I'm from the affirmative team.
Hi, I'm Joe Miguel and I'm from the negative team.
Nowadays, it is of extreme importance that everyone have medical insurance, since the world is getting more violent and more diseases are being discovered. Although not every person is able to afford such a basic need and luxury. The 2012 Lancet study suggests that broader health coverage usually leads to better access to significant care and improves population health. For example, an uninsured working age and poor American with chronic diseases would have many more complications or even die if he or she could not afford medical insurance. Therefore, a right to health care could significantly improve public health. Furthermore, according to an Institute of Medicine report, the U.S. economy loses 65 to 130 billion dollars every year as a result of declined worker productivity because of premature deaths among the uninsured. For example, when people use medical insurance, they live a healthier life and are more efficient in work. Therefore, the population will contribute more to the economy if everyone could afford and have the right to health care. For this reason, medical insurance is extremely good for economic productivity. Moreover, more than 60% of American bankruptcies were related to medical expenses in 2007, according to a medical study released in June of the same year. This happens because medical insurance is paid by the citizens, not the government. Considering that there is a variety of people who suffer from financial debt, many of them stop making their insurance payments because they cannot afford them anymore. Consequently, hospitals will feel this loss of money. Therefore, if the government would pay for public health, it would significantly decrease the numbers of medical bankruptcies. It is undeniable, therefore, that the main reasons why the American government should introduce public medical insurance to its citizens are: a right to health care could improve public health, improve economic productivity, and can decrease medical bankruptcies. The federal government, in order to pay for health care, must reduce payments for certain programs, increase taxes on gasoline, for example, and on employers who do not offer health insurance for their employees. In this way, every American citizen who lives in the United States would be able to access these services.
With the creation of Obamacare, universal health care has shown that it is not efficient. Although everyone should have the right to health care, we can't guarantee to everybody because it would decrease its quality. By 2004, in the United States, we used to have 2.7 doctors per 1,000 people. With the creation of Obamacare, the number fell to 2.4 doctors per 1,000 people. Another problem that is caused by free healthcare is the shortage of medical supplies. When a country is out of a specific medical supply, it means that the product was overused or wasted. For example, a patient that it is not in serious danger, taking the place of a patient that needs the treatment more, leads to rationing the medical supplies to avoid shortage. In the UK, medical supplies are rationalized, so everyone has the right to the same treatment, even though the needs aren't the same. The longer wait time to have an appointment with a doctor is another problem. Because there is way more people to attend, the wait time increases while the quality of the service decreases. For example, in Canada, the average wait time for a doctor's appointment is of 8.6 weeks. In the United States, the number is of 18.5 days. If the government offers free healthcare, the number would increase. Therefore, the costs of public health should not be paid by the government. If a percentage of the population can't afford a health insurance, the problem should be solved by giving opportunities to the citizens, not by making everyone pay for it. The right to universal health care has proven that it directly affects the quality of the service. So, I agree that it increases public health because everyone will be able to have health care. The problem is that the quality of the service will decrease. And although increases economic productivity, the population would have to pay higher taxes. And by giving people free health insurance, the US debt and deficit would increase.
Okay, I agree with you that by giving people health insurance, it really decreases but it's just a small price to pay for universal health care. I also agree with you that in the beginning there will be a decreases in the number of doctors, although speaking in long term, the government would increase the number of scholarships to motivate the young doctors. Although I disagree with you about taxes because the government could include the cost of supplies in the budget.
Okay,
This concludes this debate.